Wisdom teeth, or third molars, are the final teeth to emerge. They typically develop and erupt between the ages of 17 and 25. This late eruption is why they are commonly referred to as wisdom teeth. Their development marks the completion of the adult dentition process. Wisdom teeth are the last teeth to emerge, typically in late adolescence or early adulthood. Most individuals develop a total of 4 wisdom teeth. These teeth are positioned at the very back of the mouth. There is one wisdom tooth located in each corner of the mouth, both upper and lower. However, it is also common for individuals to have fewer than 4 wisdom teeth, or none at all. Human ancestors had larger jaws compared to modern humans. These larger jaws were necessary to accommodate all 32 teeth. The full set of teeth included wisdom teeth. Larger jaws and more teeth facilitated the grinding of tough foods. This adaptation was crucial for survival in ancestral environments. Tooth impaction occurs when a tooth is blocked from fully erupting through the gum line. Wisdom teeth are particularly prone to impaction due to their late development. Evolutionary changes have led to smaller jaw sizes in modern humans. Reduced jaw size can create insufficient space for wisdom teeth to emerge properly. This lack of space results in the wisdom teeth becoming trapped or impacted within the jawbone. Impacted wisdom teeth can cause pain, infection, and damage to adjacent teeth. Impacted wisdom teeth are molars that do not erupt properly. These teeth may grow at unusual angles within the jaw. They can push against adjacent teeth, causing pain and misalignment. Impacted teeth may also remain trapped beneath the gum and bone tissue. Wisdom teeth, or third molars, are the last teeth to erupt. Impaction occurs when wisdom teeth are blocked from fully emerging. This blockage can be due to insufficient space in the jaw. Impacted wisdom teeth can lead to several complications. These complications include infection and cyst formation. Damage to adjacent teeth is another potential issue caused by impaction. Dental extraction is advised when pain develops. Swelling is another indicator for dental extraction. Pain and swelling often indicate infection. These symptoms may also indicate inflammation around a partially emerged tooth, necessitating removal. Wisdom teeth, due to their location, are often difficult to clean effectively. This difficulty in cleaning makes them particularly susceptible to tooth decay. The positioning of wisdom teeth can create areas where bacteria and food particles accumulate. When significant tooth decay occurs in wisdom teeth, it can lead to pain and infection. In such cases, the recommended treatment is often the removal of the affected wisdom tooth. Extraction prevents further complications and protects the health of adjacent teeth. Partially erupted wisdom teeth can create environments conducive to bacterial growth. These teeth form pockets that trap bacteria and food particles. The accumulation of bacteria leads to the development of gum disease. Gum disease manifests as inflammation and infection of the gums. Extraction of the wisdom teeth is often necessary to resolve the gum disease. Wisdom teeth can sometimes cause problems for adjacent teeth. Crowding is a common issue caused by erupting wisdom teeth. The pressure from wisdom teeth can shift the alignment of other teeth. This pressure can also cause damage to the roots of nearby teeth. Such damage may necessitate the extraction of the problematic wisdom teeth. Removal prevents further displacement or root damage to adjacent teeth. Impacted wisdom teeth can sometimes lead to the formation of cysts in the jaw. These cysts can cause damage to the surrounding jawbone structure. The presence of cysts often necessitates surgical intervention. Surgical removal is required to address the cyst and prevent further damage. This procedure aims to protect the integrity of the jawbone and overall oral health. Before a tooth extraction, a thorough consultation is required. This consultation includes imaging techniques like X-rays. CT scans may also be used for a more detailed assessment. These scans help determine the position of wisdom teeth. They also reveal the root structure, aiding in planning the extraction. Patients have multiple anesthesia options for dental procedures. The choice of anesthesia depends on the complexity of the dental extraction. Local anesthesia is a common option for minor procedures. Sedation or general anesthesia may be used for more complex extractions. Erupted tooth extraction involves removing a tooth that has fully emerged from the gums. The dentist begins by loosening the tooth from its socket. Specialized dental instruments are used to carefully detach the tooth. Once loosened, the tooth is removed in a manner similar to a routine extraction. This process ensures minimal trauma to the surrounding tissues. Impacted tooth extraction requires a surgical procedure performed by an oral surgeon. The initial step involves making an incision in the gum tissue to expose the impacted tooth. Bone surrounding the tooth is carefully removed to gain access. In some cases, the tooth may be divided into sections. Sectioning the tooth facilitates easier and less traumatic removal. The divided sections are then extracted individually. Gauze pads are applied immediately following a surgical procedure. The primary purpose of gauze is to manage and control any post-operative bleeding. Gauze application also assists in the formation of blood clots at the surgical site. Clot formation is a crucial step in the natural healing process. Proper gauze placement is essential for effective post-operative care. Ice packs are utilized post-operatively to minimize swelling. Apply ice packs for 20 minutes, followed by a 20-minute interval without ice. This on and off cycle should be maintained. Continue this icing regimen for the first 24 hours after surgery. The initial recovery phase spans from day 1 to day 3 post-procedure. Swelling and discomfort typically reach their highest levels during this period. Bruising may also be apparent as part of the body's natural healing response. Pain management is achieved through prescribed or over-the-counter pain relief medications. Days 3 to 7 mark a period of gradual recovery following a surgical procedure. Swelling typically begins to subside during this phase. The patient can start reintroducing more solid foods into their diet. Dietary changes should be gradual to avoid complications. Continued saltwater rinses are recommended to maintain oral hygiene and promote healing. By the second week, most individuals experience a notable improvement in their condition. This improvement typically allows for a return to normal daily activities. However, it's important to note that complete healing is a process that extends over several weeks. Resuming activities should be gradual and in accordance with medical advice. Patience and adherence to recovery guidelines are crucial for optimal healing. Dry socket is a dental complication that occurs post-tooth extraction. It arises when the blood clot at the extraction site is dislodged prematurely. This dislodgement exposes the underlying bone and nerves. Exposure of bone and nerves causes significant pain and discomfort. Dry socket requires specific medical treatment to alleviate symptoms and promote healing. Infection can manifest through various signs that indicate the body's response to pathogens. A common sign is fever, which is an elevation in body temperature above the normal range. Other signs include severe pain, worsening swelling, and the presence of pus drainage from a wound. The presence of these signs necessitates immediate medical attention to prevent complications. Nerve damage can cause sensory disturbances in the tongue. Numbness or tingling may also occur in the lips. The chin area can also be affected by nerve damage. These sensory changes may be temporary or permanent. During the initial recovery phase, a diet of soft foods is recommended. Suitable options include applesauce, yogurt, mashed potatoes, and soup. These foods are gentle on the digestive system and easy to consume. It is important to avoid hard, crunchy, or chewy foods during this period. Extraction sites naturally fill with bone as part of the healing process. This bone infill occurs gradually over an extended period. Chewing ability remains functionally unaffected after complete healing. Patients often experience relief from pre-existing pain or crowding issues.